Good morning. My name is Corina Herrera Loera, Public Information Officer with the Emergency Operations Center here at Santa Clara County. We will take off our masks only during the segment so that ASL can understand us better. Thank you so much. Today we have Todd Nafziger here with us, who's also a Public Information Officer and actually leads our team here at the Emergency Operations Center. Thank you, Todd, for being here.
Thank you for having me again.
Thank you. And today we're going to talk about the regional stay-at-home order, what it means to us, to you. And before we talk about the details, Todd, a lot has happened over the last, couple of weeks. I mean, months, right? It's been months. And before we go into the specific changes, can you tell us a little bit about why the importance of going into a regional stay-at-home order?
Absolutely. Thank you for bringing that up. So our cases continue to go up at an alarming rate. We've gone over 1,000, well over 1,000 cases in one day this week, as well as we've far surpassed double the cases in one day that we've had last week. So if our cases continue to escalate like this, we'll be at a place that is not great, even when our less than 50% of our ICU capacity is not available anymore. So it's important to address this now before it gets more out of control.
Thank you.
Yeah.
And so can you tell us, now that we're in this regional stay-at-home order, can you discuss a little bit about what that means for our community?
Absolutely. And I think it's really important to note that this regional stay-at-home order unifies some of the surrounding counties. That includes San Francisco, Marin, Contra Costa, Alameda, Santa Clara County, and the City of Berkeley. So we have a consistent order that we are disseminating through our community, and it aligns us with the state so that our community can actually go to the state's website as well to see what information is available, and it will affect our community as well too.
Thank you, Todd. And I know there's specific things we can do, we can't do, and we're going to have that on the screen pretty soon for our community. But can you go over some of those things that we can do, we cannot do?
Absolutely. So for our community members, we are requiring them to stay home as much as possible, which means only leave your home to go purchase groceries, to go to the physician, to get dinner for takeout, have dinner delivered to you as well if possible. So we're really requiring people to be at home more than they have been in their most recent past, as well as no gatherings are allowed at this time, whether indoors or outdoors or with anyone with your family, unless it's for cultural ceremonies or for political expression as well.
Thank you. And as Todd mentioned, right, our numbers are over the thousands now, which is unfortunate, which means that, I'm pretty sure more people now have somebody that they know, unfortunately, that have been impacted by COVID. And so, I mean, we should have always been, taking these precautions seriously. But, especially now, over 1,000, unfortunately, these numbers duplicate fast, right? And
Absolutely.
So we don't want to see these numbers continue to go up much higher. Now, can you tell us about our local business community, what that means for our businesses here in Santa Clara County?
Yeah, so our businesses will be now required to follow capacity restrictions. They've always been required to follow capacity restrictions, but with this regional stay-at-home order, all retail establishments as well as all public areas for businesses are restricted to a 20% capacity. This also includes grocery stores and pharmacies, which just recently were allowed up to 25%. And also previously retail was allowed 10%. So the state, we are now aligned with all retail and all public areas for businesses are allowed to have 20% capacity. Personal care at this time is not allowed to open under the state's requirements, as well as dining, indoors and outdoors is not allowed at this time, but you should be able to purchase food for takeout, delivery, or pickup. If you have any additional questions as to what your capacity limitations are, you can visit our website where they can direct you as to what your capacity for your facility is, either based on your square footage or based on your total occupancy that has been assigned to your business.
Thank you, Todd. And I know that we have a calculator there on our website for easy use to try to figure out what that number is for specific businesses, right?
Absolutely.
Thank you. And then also I know that you mentioned, and I want to make sure to highlight the fact that under our state order, there's certain businesses that cannot be open. And so we always follow the one that's stricter. So whatever it is, whether it's Santa Clara County or the state of California, whichever is stricter, that is the one that we are to follow.
Absolutely. Great
Thank you,
point.
Todd. And so I know we've been talking about vaccines. There was an announcement that recently went out. Vaccines are starting to come into our county. Can you tell us a little bit about the allotment of vaccines for our county specifically here?
Yes. So vaccine has been a very popular topic because it's a very important topic, because that's what's going to help our community really overcome this COVID-19 pandemic. And the County of Santa Clara actually anticipates an initial allotment of 17,550 doses of the Pfizer COVID-19 vaccine, which will be distributed in accordance with the state and federal guidelines to healthcare professionals and residents and staff at long-term care facilities. The first phase of this approach reflects the initial constrained supply of the vaccine. So the 17,550 doses is enough to give 8,775 people the required 2 injections within 21 days. As supply of the vaccine from Pfizer and other companies begins to become more readily available, we will disseminate those vaccines out to our community appropriately, which includes first responders, critical workers, people with high-risk conditions, and older adults.
Thank you. I know it's very important for all of us to get it as soon as it's available, right? And
Absolutely.
Start making plans, maybe not within a month, but hopefully within a couple months that most of us are able to get that. And now, we're at the end of our segment here. Anything else that you would like for our community to know before we end today?
Absolutely, and thank you for asking me that as well, too. There's been a lot of changes, and I think one of the more critical changes have been to our lodging facilities. So lodging facilities, what I mean by hotels, motels, etc., they cannot accept or honor out-of-state reservations at this time for non-essential travel, unless the reservations for or at least minimum time period required for quarantine and the persons identified in the reservation will quarantine in the hotel or lodging until after that time period has expired. So that's been a very big change, where it's something we didn't have before. With that being said as well, we are strictly requiring people not to travel if they don't need to, and that includes for essential business and or if you're a health provider coming into this county. Those are some of the conditions in which you would be allowed to travel. So travel for leisure, we are strongly discouraging that to happen at this time, as well as we want to encourage our people and our community to please get tested. Also remember that testing is not a passport to travel. Just because you received your test and it came back negative, we're not encouraging people to travel because you were negative that day. You may not be negative the next day. So please, if you're a frontline worker, get tested at least once a month and no more than every 2 weeks. Also, employers must continue to maximize the number of staff that work from home. Just because you can bring people into your office doesn't mean you necessarily need to. So please continue to remember that. And then also the basics. Please continue to wear your face covering, as well as remain more than 6 feet apart from individuals when you leave your household. And also, just for our community, please be safe and also support your local businesses. We're all suffering at this time. So do your best as to what you can do to contribute to them, and order takeout, order online, do what you can.
Thank you, Todd. Very important information. Thank you for leading our team to the community. Thank you for paying attention. Thank you for tuning in, taking note of the changes as they come in. We're going to do our best to get that information out to you as soon as possible in different ways, as you've seen. And, just want to remind all of us, in our homes to be creative, be with our children, our pets, maybe a garden. During this time, as Todd mentioned, it's really difficult times. And we get to be creative and stay home. Please stay at home, save lives. And we will see you again here at Facebook Live in our new times once a week moving forward. Just pay attention to the changes because those things might change. But thank you for tuning in, and we will see you soon. Thank you.